Hello, hi guys, it's Bundengese here. Botshilu Private Hospital. It's a new day. Huafisa, dinoyendi tabile le naga tabile. Today, re tla kopana le Dr. Kekana, o eleng hore o dila ka breast cancer, radiologist. Bona, nna le wena a re iketle mmogo. This is Connekt Media podcast. A re tsena ka mohare, re khone hore re tso go etsahalang. Dango. Hello, hi guys, this is Connekt Media and it's yet another beautiful day. Botshilu Private Hospital, and today we buisana le Dr. Engwe epila hambe batho ngwe go monate go le presenter bana ba ntse ba romela di doctor tse alright yana. Bona, today re bua ka taba engwe e serious blind. We're talking about breast cancer. Let me not waste time. Hi doctor, how are you?
I'm well, and how are you?
No, I'm good. I hope you slept well.
Yes, I did, and thank you for the invite. And
okay. Can you please introduce yourself to our viewers?
Hi, everyone. My name is Slyjay Kekana. I am a radiologist at Botshilu Private Hospital. Mm-hmm. I qualified my medical degree in Medunsa University and then went on to specialize as a radiologist in Wits University.
Okay, doctor, let's start here. Radiologist. Can you please explain what is that for those who don't know?
A radiologist is a medical specialist who specializes in X-rays, to be exact. So we basically are reporting X-rays. There are different types of X-rays. You have your normal X-rays where you have broken your arm and we can do an X-ray on that. Then we have other specialized X-rays like your ultrasound, where we then use ultrasound to look into your a part of your body. The other ones include CT scan, where we have radiation going through your body and we take images, and those images are then sent to us as radiologists and we interpret them. You also have another form of investigation called an MRI. So we are basically diagnostic radiologists. What we do in the chain of medical treatment is we help doctors diagnose illnesses. And then we then say to them, this is what we think it is, and we agree with them. And those that are surgeons will go on and operate, and those that are physicians will go on and treat patients. So we are basically a helping hand to other specialists in the field.
Dr. Karata, helping hand. Helping hand happen. Honale solution in terms of cure ya whatever e longore le tlabele grile e longore le fila hore no ke yone ka reng ena le problem mo mmeleng wa motho.
Yes, so let's make an example. For instance, if you go to a GP and you present with an abdominal pain, you will then be sent to us to investigate do you have an abdominal pain. Then we will then do X-rays or ultrasound or even a CT scan to say this is the cause of your abdominal pain. Then we will send you to a specialist who will then manage you further in terms of your illness. So that's why we are helping other doctors to manage patients. Okay.
Now, doctor, today it's about breast cancer, but before it's hayona. I just want to understand one thing. You know, there's so many things that you could have chosen. I love asking these questions. You know, you could have been a lawyer, you know. Why did you choose this profession?
Sure. Why did I get into this profession it's actually a long story. I studied Bachelor of Sciences in University of the North. And when I finished, I was just 21. So when I finished my degree, my dad was like, where are you going to work as a 21-year-old? You're so young. What are you going to do? And then we started toying around with the ideas. Maybe I could be a pharmacist. And he, at that time, pharmacists were not the most profitable, I guess, in his eyes.
Yeah.
He said, no, you can't be a pharmacist. You're still going to have to work for someone. So maybe the other thing that you can do is you can be a doctor. And I was like, because I can study, I don't have problems with studying, and I don't have anything that I'm thinking of doing right now, Baba, I can do this. And then that's how I got into medicine. It wasn't something that I dreamt about when I was still young. It wasn't something that I wanted to do when at some point, but it was just a matter of me and my dad discussing it when I finished my Bachelor of Science degree.
Yeah, I think Dad Mwaling are proud.
Yes.
Because as one of them by long hore but sorry ba wala lor normal this is what you can do ba yetsa, you know, if na doctor no decide ho na soccer player.
Yes, Daddy Dearest was my favorite person, and he is always he's always close to me. He's my guy. So when we talked about it, it made sense for me to do this, and it was like but me and Daddy could sit and talk about it then in those ages, and my dad was my person. He is no more, but yes, he still remains my human.
No, may his soul rest in peace. That's
Thank
beautiful
you.
because Hansi bana babanyana baba the relationship to good live to baba shimane lebontate. So in your case, no, it's really beautiful.
No, I'm Daddy's little girl, through and through.
Yeah.
Yes, I'm Daddy's little girl.
All right, doctor, let's not waste time. Breast cancer. What is breast cancer?
Breast cancer is an illness that affects both males and females' breast tissues. So you have a tissue that you call a breast. That breast has got several, I can say, parts or molecules. Okay. So it has got fat, it has got glands, and it also has ducts. That structure can have an abnormality. Okay. And when there is a certain growth that happens on the breast, and we test it and we find that it's called breast cancer, we then have to start managing it from there. So basically you take a breast and that breast tissue has an abnormal growth.
Okay.
So normally what is supposed to happen is you're supposed to have normal cells dividing normally. But when it comes to breast cancer, there are abnormal cells that starts in that breast, and those abnormal cells, because they are abnormal, they divide quickly. And then as they start dividing quickly, you then develop a growth, and that growth can come in many ways. A person can present with a lump, which is the commonest way to find breast cancer. But others don't even have a lump. They will have a nipple discharge. Their breast will secrete fluid that is abnormal. That could also be a sign of breast cancer.
Okay, doctor. Before I go call,
Yes.
if that woman on alongwana and a breastfeeder, I dangerous mongwane because at that time maybe have one and she has to.
Yes, you do have people that breastfeed, mothers that breastfeed that could also have breast cancer, but those ones generally they would have a lump. The breast the breast would feel abnormal. It would feel painful. It would feel fuller. There would be something that will make you think this breast is not the same as this one. But then, if you have breastfed that child, it's not a train smash because it's not like you're going to kill the child immediately. No, it's not. The fluid is not going to kill the child, but it's one of the things that can people can present with. I don't want to say ladies because breast cancer is not for females.
How?
Breast cancer is for everybody. So that's why, yes, that's why I'm saying a person can present with a lump. A person is everybody, males and females. So breast cancer can affect you, can affect me.
Yeah. So now, doctor, I want to know, how is cure for breast cancer?
We can say that because breast cancer is one of those mostly investigated types of cancers.
Yeah.
And it is also very far in terms of management.
Okay.
So with cancers, it's not a cure that you get, but it's a management of the cancer that you get.
Okay.
That's why people who have had cancers, you follow them up every year because you want to check if the cancer hasn't come back or there's no other place where the cancer has developed. So it's not, when you're saying management of cancer, you don't cure it, you just manage it. And you have got different ways to manage it.
Okay. How dangerous is breast cancer?
Breast cancer is dangerous, especially if you find breast cancer late.
Oh.
So what normally happens is, I'm Malijima, I have got a little bit of a lump, and I say it's nothing, and then I live with it for the next 2 years or 3 years, and then on year 4 I decide, no, this thing is not right. I need to have it checked out. Think about it. It has taken you 4 years to present. So if it has taken you 4 years, what has happened if that is an abnormal cell? So what breast cancer does is, it starts in a breast, but it can spread to other parts of the body. That's where its danger is.
Yeah.
So you have a lump, it's in your breast, and it's an abnormally growing lump. Then through your bloodstream and through your lymphatic system, you can then have that cancer spreading firstly to your armpits, to your lymph nodes. And from the lymph nodes, it can spread also through blood to your bones, to your liver, and to any other organ in the body.
You said something important. You said igaba dangerous starter if you not agree late.
Yes.
So how do I check myself if you know maybe something so long or I can show us on?
We do what we call self-examination.
Yes. How do I?
That's where you start. Can I show you?
Yes, doctor, you can show me.
So when you do self-examination, you take a palm of your hand and you move through your breast, and you move through your breast, and you move through your breast. It's a circle, and once you've done that, you then know what your breast feels like on a normal basis.
Oh.
You get used to it. With females, there is something called menstruation. When they are menstruating, their breasts, they become big. They engorge, and sometimes it's not the right time to test for your breast. A week after your menstruation, you then have a system of examining your breast once every month, just to make sure that there is nothing abnormal that you can feel. So self-examination is the first. Most of the time, though, which is very interesting, breast cancers are not found by the people that have got breast cancers. It is the partners that actually feel the lump.
I was going there, doctor.
Yes, I knew you were going there. That's why I took you. I made it easy for you.
Yeah.
Yes, so partners are the people that are very helpful in terms of recognizing breast cancer, because they have palpated that breast and all of a sudden there's something that they're palpating that was not there before. Yes.
So it's very important to
It's important to do that, to palpate the female breast every now and then.
Guys, I don't know if you hear this one or you understand this one. it's very important if you are in a relationship or you are married. It's very important. But for it, it's very important.
Touch those breasts. Don't be afraid of them. Yes.
And for us men,
for you men, it's generally there are men who have what we call gynecomastia. Gynecomastia is just literally swelling of the breast in males. So if you realize there are males who have got what you call men boobs, you know those? Yeah, they look like banal matswele. Those ones, yes. Sometimes you might feel that you've just developed a man boob from nowhere. You go to the doctor and say, this has happened to me, is this normal? And then sometimes you find that also you might find a lump. You go to the doctor and say, I have found a lump in my breast, is this normal? The problem with males is, one, they don't go to doctors. Two, when they see something, they say, it doesn't happen to me, it will happen to somebody else. That's wrong. So three, they are just afraid to go and expose themselves and be vulnerable to the next person. What do I mean by that? They do not want to share the most deepest secrets. So because of that, you will find that with them, breast cancer, you will find that it has already spread before you actually find it. And that's where I say breast cancer, generally, people come and present late.
Doctor, you mentioned something important, and I think since we are here, I think we must help men out there, because most men bahola ka ntho ya hore ba re monna halle monna tshwanetse a be strong, all those kind of things. And I think dilo tseo ke tsona tse le hore feletsa di etsa hore de ba hodile dilo tse ding tse ba di tshware mo bona le ha bona something se leng hore se ka nna dangerous for bophelo ba hae. We keep a moyena. He doesn't even say anything or consult. How important is it to make sure you go out there and then you consult and you make sure everything is okay with your body?
Consultation is supposed to be at least once a year. Once a year, you're supposed to visit your nearest GP and say, I am here, I am so-and-so, and I just want to have a checkup. What checkup does for everybody is you will find things that you didn't know exist. You will also find out that you will be able to know when something abnormal starts happening because you know what you had last time. So it's important to go and visit a doctor. There is no other way of saying it. Once a year, go and visit a doctor and just have a complete checkup. It will help you in the future, especially as we grow older. Because remember, as young people don't really go to doctors, it's okay. But when you start getting older, there are diseases that affect older population, and that's why you need to be going to the doctor regularly.
Okay. Earlier we spoke about the importance of men, if Lorna Lemoto, for Tshwaramatswele. And I don't know, Hore, is it true, but I've heard stories of Norman. It's all normal to Tshwaramatswele too much. They grow fast. And Babang, they're afraid to allow themselves to do that. So I don't know if it's true or if it's not.
So I'll share a small story.
Thank you.
I'll share a story that I normally don't share. So
okay.
I when I was I think 11 or 12, and I started developing breast buds. I had my gran take a broom and literally feeling my breasts so that they were not supposed to grow, you know. But and then obviously I still have small boobs even today. So I thought it was because of that. But if I look at my mom still doesn't have a lot big breasts. So these things can be genetic. It's a myth. It's a myth to say that when you touch the breast, they will grow bigger. No, it will just, if your breasts were going to grow big, they will. If they're not, they were not. So it's something that it's said, but it's just a myth. Yeah, you can touch them, it's okay.
Now I want to ask this question, Doctor. Breast cancer, it leads to or ba cut off the breast. Go fitla yang hore e felletse e fitla mo pointing mo elong hore they have to cut it off.
So we go back to breast cancer presenting late.
Oh.
So when you get to a stage where the cancer has involved more than 2/3 of the breast, for instance, or it has spread, what doctors normally do is they can do what we call a mastectomy.
Okay.
Mastectomy is removal of the breast. That's generally the first step to management of that breast cancer. Sometimes if it has spread too far, what they do is they then would give you a dose of chemotherapy before they operate, because the dose of chemotherapy will then reduce the size of the lump in the breast or the size of the cancer. So in this day and age, if you go and present early, what they can do is a lumpectomy. Okay. Lumpectomy is not removing the entire breast, is removing a part of the breast which has got the disease. So you have an option. But when you are too late, there is no more options. You need to remove, the surgeon will tell you that my management is as follows. I will do a mastectomy, which is removal of the entire breast. And then whether the mastectomy will be followed by chemo or the chemo will precede the mastectomy, it will depend on the surgeon and your oncologist.
Yeah, no, doctor, I'm learning a lot. I don't know about the viewers. Guys, we're still chilling with Dr. Kekana here, and we just want to take a short break. I have few questions from our social media platforms, and I will make sure from our doctor. This is Connekt Media. Spoonding yes. Still chilling with Dr. Kekana, and today we're talking about the breast cancer. Welcome to the show. This is Connekt Media podcast. Doctor, you still having fun?
I'm still having fun. Thank you so much.
Yeah, Doctor, I'm happy when you're having fun because now I'm learning, and I'm learning a lot.
Yes, learning is good, and it must happen at all ages, so it's okay.
So not to college is wearing doctor go heki fitla high. I must not waste time. So ke poto as a doctor.
Palpate.
Ke check and for next month he could go runa le ntho ka renga ya nisa pila ke itse hore a wa siama.
Yes, you must do that.
All right, doctor, I have questions here, but before checking the questions on social media, I have two questions for you. If on a breast cancer, hona le dijo tse leng hore wa tshwanna ho dija or hona le dijo tse leng hore o tshwantse o je tsona fela na?
Yes and no. Let's start with the food. Okay. With food, you must just be on a healthy diet. Your healthy diet will include your fruits, fresh vegetables, you know, the normal things that you're supposed to have, a good enough amount of protein. So you basically need a balanced diet.
Okay.
But there is something more important, and it's the alcohol. A lot of times we do not tell people that when you have breast cancer, you need to limit or stop alcohol, because alcohol consumption during breast cancer can affect you, and therefore you need to just limit it if you can't stop it.
So doctor, a hona bolwetse bo ilong hore bo teng mo lefatsheng bo ilong hore bo re ba bona he o tshwere ke bo? Drink alcohol as much as you can.
None that comes to the top of my head, but possibly is there. I don't know. I don't know of any.
Okay, and how about smoking?
Smoking is also a danger, and therefore you need to reduce it when you have things like breast cancer.
Okay, you spoke about changes. So a young person is watching now, and wait, I was breast cancer.
So breast cancer affects young and old. Young is not your 15-year-olds or your 20-year-olds, but it's your 30-year-olds.
Oh.
And then old is up to your 80s.
Okay.
So in young people, unfortunately, breast cancer is very aggressive.
Oh.
Their breast cancer is much more aggressive, and therefore it's important that you actually find it early in them.
Okay.
So it's aggressive, it can spread, and it can be found late because we generally don't investigate them. So in South Africa and other countries so far, what we do is we have something that we call breast screening. Breast screening is what happens when you are 40 years and above. So your medical aids will allow you to do a breast screening, and you can also walk into a practice like ours and say, I am above 40 and I need to check my breast. How do we check your breast? We do what we call a mammogram.
Okay.
A mammogram is X-ray of the breast. We then do the mammogram, we look at your breast on X-ray, and then we decide whether we're doing an ultrasound or not. But the young ones, your 15-year-olds, can still come to the department if they have got breast lumps, because breast lumps are not only for adults. It's only breast cancer that will be from the 30 years up and above. But your breast lumps, you can have a 15-year-old with a breast lump. We manage them differently when they have breast lumps at that young age. So those young ones, we will do what we call a fine needle aspiration, where we put a small needle into the lump and we take it and we send it to the laboratory, and the laboratory tells us what that lump is. It's not common to have breast cancer at that age. They have what we call fibroadenomas. It's breast lumps that are not malignant. Malignant meaning they don't spread. They will just stay in that breast forever. So I always say to them, if you are 15 and you have got a breast lump and we have found it and we say to you it's a fibroadenoma, what you can do is you can decide whether you want to take it out or not. So once you decide to not take it out, you can live with it. But because you now know that you've got a lump and you've got a growth, people don't actually agree to keep it. They want to take it out. So we send you to a surgeon who will then remove the lump.
Okay, doctor, I just want to get to the questions. But before I let you go later, there's something important that I want us to talk about.
Yes.
All right. First question is from Tembi. Tembi says, what are the different types of breast cancer and how do they differ? 2, can men also... Okay, I think we spoke about this one.
Answered that.
Yeah. So, the first one, what are the different types of breast cancer and how do they differ?
So the different types of breast cancers differ with the types when you have taken the specimen. So let's take the specimen from your breast.
Oh, okay.
So you have walked in, I said you came in and you said you are over 40 and you want to do a mammogram. We've seen a lump on mammogram and we want to investigate it.
Okay.
As a radiologist, I will then put a needle into that lump and I will take a sample. I will send that sample to the laboratory. The laboratory is the people that will tell us the type of breast cancer that you have.
Okay.
Now, also coming to types, when you are having a breast cancer or even before you have breast cancer, there is something that we call family history.
Oh.
Family history is very important. Is there someone in your family that has breast cancer?
Yes.
Is there someone who died of breast cancer? Is there any other cancer in your family that you have? Those questions, we ask them because when you are a first degree relative of someone who has breast cancer, you are at risk. Your risk increases as compared to someone else. So it's important for us to ask those questions because they help us. And that's why I was attending a webinar recently in the UK where they say they don't test anyone everyone like we are doing now in South Africa. What they have now done is they only test people that have got certain receptors, and those are the people with positive family history. Those are the people with certain types of receptors. We call them breast cancer receptors. So those people will be tested, and then once they are tested, they will then be followed up, as compared to you having random people walking in and doing tests. But we are not there yet. We are still in South Africa. In South Africa, we have got issues. Our problems are still the fact that people don't come and present to the hospitals. So we cannot be telling people to sample them. We cannot be saying only these people can come. In South Africa, we are saying if you are over 40 years, you need to visit a doctor's rooms and tell them you want to do mammogram, and the doctor will send you to us, the radiologist, who will do the mammogram for them and will follow you up either every 2 years or every year, depending on the money that you have and the medical aid that you are using.
The money that you have.
Yes.
You must have money. It's important to also have medical aid. Okay, we also have a question from Belinda. Belinda says, what are some common risk factors for developing breast cancer? 2, are there, okay, no, this one you also answered it. Yeah, the first one.
Yes, there are risk factors. The commonest one, when you are overweight, or as we say, obesity, it's a risk factor. You can be prone to breast cancer. And
what is overweight?
Overweight is when your body mass index is above a certain number.
Okay.
Yes. So when you are overweight, you are at risk.
I want to know, when it comes to overweight,
your body mass index should be more than 25, I think. Your normal is 25. So we use your weight and your height, and we have a certain percentage, and we calculate your body mass index. So your weight and height will determine what your normal body mass index is supposed to be. That's how you calculate whether you are overweight or you are obese. Yes.
Yeah.
So that can be a risk factor, especially if you are obese after menopause. Yes, you are running a risk of, it's a risk factor for developing breast cancer. The other thing is taking hormones.
Yes.
In young ladies, it's taking contraceptives, and in elderly, it's taking hormone replacement therapies. You are also at risk. That's why those people, you need to follow them up much more regularly. Especially the ladies that are on hormone replacement therapies. You need to follow them up regularly. They must have regular mammograms. The other thing is your reproductive history.
Okay.
When you are young and you had your first pregnancy after 30 years of age, and you have had a baby and you didn't breastfeed, and you never had a pregnancy that was full term, those are the risk factors. And we find that those ones are the patients that will have breast cancer whilst they are still younger. Yes.
I hope you answered. And guys, I hope you're learning. This is what I always say. Have a pen, diary, or make sure that you record. And also use Google.
Yes.
For the term it's yes. And then maybe how
yes, you can. Yeah.
Thank you so much, Doctor. All right, we also have Ntabiseng Are. How often should women get mammograms, and at what age should they start? 2, what are the benefits of regular self-exams, and how do you properly perform one?
Okay, the self-examination, it's exactly the one that I said.
You spoke about, yes.
You lift your one hand up, the breast that you are going to test, you lift your hand up, because once you do that, you stretch all the muscles. So you then use the palm of your hand, not the fingertips. And then you circle, you go around your breast.
Right.
Use your breast as a circle, and then once you are at the end, you will then feel if there's anything abnormal, you can repeat it. Then you change and you go to the other breast, you do the same thing.
So you don't just move
you
your
don't
hand, you
you
have
don't
to-
move your hand, you don't grab the breast, because
Yes.
when you do that, you run a risk of missing out lesions and also calling normal breast tissue a breast lump. Remember, in young females, I said that's why I said you mustn't do self-examination when you are during your menstruation, because your breasts are generally big. So you are going to feel as many lumps as you can, but therefore you must do that. A week later, you can then do your breast self-examination. Once a month, it works. If you forget once every 2 months, it's still fine. Then, as I said, for breast mammograms,
Yes.
we do that with this in this country. You have to be above 40 years of age for you to come from a mammogram. But when you have a breast lump, even if you are 30, do not wait for 40 years and say, because they said I must come at 40. Come at that time. We will decide after doing a breast ultrasound whether you qualify to go and do a mammogram or not, because of our findings.
Okay.
Because I said young patients can have breast cancer. So that's how we investigate it. You must always say, if I have a lump, bring it, we investigate it, and we tell you what that lump is. If it's breast cancer, we can then manage you differently.
Okay. We also have Lebo. Lebo, are there different symptoms that could indicate a potential tissue with breast health? And two, besides self-exams, are there other ways to promote breast cancer?
Except self-examination, it would be you visiting your doctor and
Yes.
having that consultation that I said you need every year, a general checkup. Because it might be at that general checkup that your doctor might pick up something that is abnormal. So sometimes your breast would be a little bit, they're not the same size. We know that breasts are not the same size, but a doctor might pick up an abnormality in terms of the size of the breast. One is bigger, much bigger than the other. And then when they investigate, they find that there's something else. And then sometimes there is a color or a skin that becomes slightly yellowish. We call it pidorange.
Okay.
It's just thickening of the skin, and the skin looks slightly orange. And that could be the only thing that is the symptom that we can pick up. So it's important for you to visit a doctor. If not a doctor, it's a clinic, but be regular with those things, because you can then pick up something, or the doctor can pick up something, or the health worker will pick up something that you were not aware of. There is also something called nipple retraction. Some people's nipples are nice and sitting up and it's okay. Then other people's nipples, all of a sudden your nipple just disappears.
Okay.
It could be a sign of breast cancer.
Oh.
Yes. So you might not have a lump, you might have just nipple retraction.
Let me ask this question, doctor.
Yes.
All of a sudden it disappears.
Yes.
So now, if give me a phone number, doctor. So if Papa Nengese or Manengese Atla Air,
It doesn't come out.
Oh.
Yes. It stays retracted.
Oh,
That's
okay.
what we call a retracted nipple. So you knew that your nipples were normal before, and all of a sudden this one has just disappeared, and you're asking yourself, what happened to my nipple?
Yes.
Yes. And it doesn't get aroused, yes. But then there are people who have been born with those kind of nipples.
Oh.
And they will tell you when they walk into the practice that, no, my nipples are like that.
Like that,
And
yes.
if they're like that, it's okay.
Okay, there's no sign of
There's no
cancer
sign.
there.
Yes, but
They were born like that.
you could have just nipple retraction as a sign of breast cancer.
But that doesn't mean you must not go and check.
Yes, that doesn't mean you mustn't go and check. Yes.
All right. We also have Precious. Okay. Oh, all right. Yeah. I think this one did it. We also have Juno. Juno says, what are some potential side effects of breast cancer treatment, and how can they be managed? And another one, how long does it usually take to recover after breast cancer treatment?
Breast cancer treatments are different. Okay. We started with a mastectomy or lumpectomy. That's surgery. So when you have had surgery, it will take you maybe 6 weeks to recover fully, to go back to normal.
Yes.
That's surgery. And it will also depend if your operation was successful or you had other complications. Okay? 6 weeks at least, you are okay. Now, there are other management of breast cancer that we didn't speak about. One of them is chemotherapy.
Oh.
I said to you, you can have chemotherapy before you have the operation or after. Chemotherapy is the one that normally gives people bad side effects.
Oh.
What is chemotherapy? We give you medication via a drip. This medication is supposed to kill the cancer cells, literally kill them. And now, when it goes into your body, it sometimes does not know which one is supposed to be killed.
Okay.
So what does it do? It affects your whole entire body. And when it does that, what are you supposed to do? You're supposed to have your oncologist is the person that administers this chemotherapy drips. When they administer them, they will tell you, these are the side effects of the drip. You will have, for instance, dry mouth. You won't be able to eat. You won't be able to drink hot or cold stuff. So they give you all the side effects. Some people are lucky. They don't get all the side effects. Others are not as lucky. They have all of the side effects.
Yes.
And it will depend which chemotherapy you have had. So that's different mixes. So the mix that you have might be the one that is very severe. So people that have had breast cancer, they will tell you, they even know the colors of those strips. They say, we're having the red one now. The red one is dangerous. And then they will tell you, no, I had the easy one. That one, I actually have it today and tomorrow I'm back at work.
Oh.
Yes, so it depends, and it also depends on how people react to different medication, obviously. Other people will react, they will have severe reaction and others won't. But generally, chemotherapy is the worst in terms of the management. The last one is what we call radiation therapy. Radiation therapy, we literally put you under what it looks like almost the X-ray type, but what you do is we then burn the area that has got disease. And those ones, they end up with a skin that is thickened and hard. So it's the chest, they've removed the breast already, the chest becomes hard. And even if you have found that they couldn't do an operation because your breast cancer was already very far, then that part of the breast is like a hardened breast. It's because you have radiated it. Literally, you are burning that area with radiation.
Doctor, we're almost done. I'm only left with about 2 questions. But before these questions, I just remembered something. When I learned about cancer and uluza. So I don't know, is that one related to breast cancer or it's a different one, that one?
It's not related to the cancer. It's related to the treatment.
Oh.
It's chemotherapy that will give you those side effects. So chemotherapy is one of those that affects everything in your body. So it actually gives you that thinning of your hair, and your hair, you have hair loss. You literally have bunches of hair that you take off your head every day. And then eventually they stay as bald and it becomes easier for them because their hair doesn't grow.
Guys, There's so many things that you know. So I think now we all understand hore are motho e leng hore o na le cancer o tlhobeha meriri. Chemotherapy ke yona e etsang hore I didn't know that, doctor.
Yes, ke medication over ukreang, and that's why ke go it's different medications, different times, and some of them are very, very aggressive, and therefore they will end up with hair loss.
Okay, and weight loss.
Yes, and also weight loss. Remember when they are having chemo,
Yes.
they're not eating as well because their mucosa, so from the mouth all the way to your rectum, literally, your mucosa becomes, it has got ulcers, it's difficult to eat, and that's why very cold and very hot, hot stuff, it's difficult, and therefore you eat a little bit, so you're not eating well. So that's why you have your weight loss as well. But the cancer itself, when it's very severe, when it's very late as well, it has spread to your bones and it has spread to your liver, it could give you weight loss as well.
All right. I also have a question from Melita. How can patients and survivors cope with the emotional and psychological impact of breast cancer? And 2, are there support groups or resources available for individuals affected by breast cancer?
Yes. So how you support a patient and their family is in certain centers, like big centers. We're talking about places like your George Mukari, we're talking like places like your Helen Joseph Hospital.
Yes.
Those centers are big centers of breast cancer patients. So in those centers you will find that they have got support structures. So they have got survivors, and they have got some patients who are families of people that had breast cancer that support the patients that have got breast cancer and their families. You can also ask to see your psychologist, because your doctor that you are seeing needs to manage you holistically. So your surgeon can also recommend that you guys go and see a psychologist, and so that you can get help. And there are breast cancer support groups, but as I say, it's important to call those places, because what they do, especially in Helen Joseph, I'm sorry, I worked a lot in Joburg, so I will refer to Johannesburg more than in Pretoria. So in Helen Joseph, for instance, they have got certain people that will follow you up, they live close to you, then they will check you up, they will make sure that you are having medication, you are well, and they will also explain to you the symptoms. So it's those support structures that are there, but it's mainly in big centers where they give you support. You can also Google and look for breast cancer support groups. You can find them. Breast cancer is horrific, especially if it affects one of you. But what you need to do is you need to stay positive as much as you can, especially for the patient and the immediate family. And even as a doctor, you need to make sure that those people are taken care of. Yes.
All right. Guys, don't be surprised. Le magatse ki no ise o garana na recommending no. Botshilu Private Hospital, obviously hona le movement, and hona le ba bang ba ilo chekiwa matswele, so skamagala re mo hospital ngwana papa. I get a doctor. Ke sure le the patients it's already mates.
Yes,
are we almost done? We're almost done. We have Mapule. Are there different lifestyle changes? Okay, we spoke about this. Okay, but yeah, are there specific lifestyle changes that survivors should consider post-treatment?
Yes, it's basically you follow a healthy diet, you look after yourself, you go to check your checkups annually, and it's not everything that you do that will change. It's just you looking after yourself and making sure that you are taking care of yourself. So your balanced diet, your looking after what you drink and what you eat, it's the most important.
Okay, last question. How can individuals raise awareness about breast cancer and support others? Are there organizations or initiatives indicated to breast cancer awareness and support?
Yes, so what we do, for instance, in Botshilu Private Hospital, every year, starting from October and going to November,
Yes.
we conscientize and make people aware of breast cancer. We not only speak about it, we go to places of people's work, we go to shopping centers, we talk about breast cancer, how you can get it and how you can investigate it. And there are support groups, it's breast cancer awareness groups, and you can look for them, and you will find that in your area there might not be an active citizenship about breast cancer, but you can try and start something small in your local community. It's important. You can always speak to us, you can call us, and we can give you the pointers in terms of what to do. We also have a few of our patients that have been survivors for the few years who are willing and can come and speak at your events. They can also come and support you and give you the pointers in terms of what to do.
Okay, Doctor, thank you so much. We are done with these questions, but I said there's something important that I want us to address or talk about before I let you go.
Yes.
We have people who believe things.
Yes.
You know, and I'm just going to mention few.
Yes.
You know, we have Christians, we have where they believe in sangomas and all those things. You know, and sometimes you'll find something ask and then I don't know, I will go to church and then they will just pray for me and I'll be okay. You know, and then I will go to church and they will pray for me. And we have so many people because of that. You know, so how important is it, even if you are a believer? How important is it? Because I believe even God, this profession, they will assist people. You know, so how important is it for a believer, whatever believer or whoever believer, but how important is it for some changes?
It's very important.
Yes.
I went to school in ZCC, Moria.
Okay. Mm-hmm.
So people always said ZCC people don't want to do this, or they don't take medication. But with time and with education, people have changed. They know that they are Christians and they follow a certain Christianity. But when it came to their high blood medication and their diabetes medication, they're taking it. What is different with cancer? Nothing is different.
Yes.
It's still you who want to live. The thing is, prayer is there and it will help you to go somewhere, but it will not heal. There's a lot of people who have died because they went for prayer and they left their breast cancers to spread. We have seen people that have gone to a traditional healer. Yes, you can say it's their belief, but when it comes to your own body, it depends how serious you are about you wanting to live.
Yes.
How long do you want to live? Do you want to live so that you can look after your kids and your children's kids, your grandkids? Or do you want to be an example of someone who was such a believer that they did not want to be shown another way? Medication is another way of God enlightening us. He is the one that we all pray.
Yes.
We, as we are going to touch you, we say, thank you, God, for the amount of the energy and the faith that you have in me so that I can heal this person. So these things, we say them, we do them, but why is it when it affects you and your health, you decide that you do not want to engage it? Engage yourself in those different therapies, and maybe you'll be one of those that will survive, and you will be talking about it and saying, I survived because when I prayed, I said, God help me, and you went and you got help from someone else as well. Just, it's something that we all miss, in a sense that you are human, yes, you've got all the things that you do, but remember one thing. It is just this body that you have.
Yes.
If you don't look after it, who will? No one.
No one. Doctor, thank you so much. Your last words to our viewers, maybe they want to consult, they have more questions. How do they get you?
We are in Botshilu Private Hospital, radiology department. We actually have walk-in patients that can come and say, I'm above 40, I need to do a mammogram. You don't need to see a doctor sometimes. Other patients can go to their GPs and say, I want to do a mammogram, and they are sent to us. And also remember, in October and November, we run specials that go with breast cancer awareness. So you can call and find out if there are specials and how much it is to do a mammogram. Mammogram is done once every year or once every 2 years, and therefore you can start budgeting for one for next year if you don't have money for this year. Medical aid patients, remember, mammogram doesn't come out of your day-to-day funds. It comes out of your specialized investigations, and therefore you don't pay hard cash for it. So make sure that you investigate all these things. You find out what is it that you can do. You come to Botshilu Private Hospital Radiology Department, and we will help you. Thank you so much.
Thank you so much, Doctor. I learned a lot, and I believe that I'm still going to learn.
Yes.
Thank you so much, Doctor.
Learning doesn't end. Thank you so much.
Yes. Guys, let me just say this before we close. Motho package CV ya hae pila wa e tshwara ha fetsa fela a re go ya ko kerekeng ba ilon rapella gore ke kerespane o ya ko kerekeng ba mo rapella o ya ko kerekeng ba mo rapella o boa hae o bia CV wa relax o expecta ho kry mmereko. In short, modimo o thusa o ithusa. So make sure gore go utlwa gona le something se le gore a tsamaye sentle mo mmele wa hao. Pray, but go and consult. Slyjay, Connekt Media, we were talking about breast cancer. We coming back. We not done. Make sure you keep on tuning in every time online. Thank you so much for your time.